Chapter 13 Education and Advocacy in Sexuality, Promoting Awareness, Reducing Stigma, and Championing Rights. Effective education and advocacy are crucial components in promoting sexual health, reducing stigma, and supporting diverse sexual identities. Comprehensive sexual education and public awareness campaigns help individuals make informed decisions about their sexual health and foster inclusive attitudes. Simultaneously, continued advocacy is essential for addressing disparities in sexual health and rights, particularly for marginalized communities. Awareness and education. Comprehensive sexual education. Curriculum development. Comprehensive sexual education encompasses a wide range of topics, including anatomy, contraception, sexually transmitted infections, STIs, consent, healthy relationships, and sexual orientation and gender identity. It aims to provide accurate and inclusive information that prepares individuals to make informed decisions about their sexual health and relationships. Early and continuous education. Introducing sexual education at an early age and continuing it throughout adolescence and young adulthood is important for fostering a healthy understanding of sexuality. Age-appropriate content ensures that individuals receive relevant information as they grow and develop. Public awareness campaigns. Promoting safe practices. Public awareness campaigns play a vital role in promoting safe sexual practices. These campaigns can address topics such as condom use, regular STI testing, and the importance of consent. By reaching a broad audience, they help normalize safe practices and reduce the spread of STIs. Reducing stigma. Campaigns aimed at reducing stigma around sexuality and sexual health can change societal attitudes and encourage open discussions. This is particularly important for marginalized groups, such as LGBTQ+ individuals, who often face significant stigma and discrimination. Inclusivity and representation. Effective campaigns are inclusive and represent diverse sexual identities and experiences. This helps ensure that all individuals feel seen and validated, fostering a more inclusive and accepting society. Utilizing technology. Online resources and tools. The Internet offers a wealth of resources for sexual education and awareness. Websites, apps, and social media platforms can provide accessible and engaging content, from educational videos to interactive tools and forums for discussion. E-learning platforms. E-learning platforms offer flexible and comprehensive sexual education programs that can be accessed by individuals regardless of their location. These platforms often include multimedia content, quizzes, and interactive sessions to enhance learning. Advocacy efforts. Addressing disparities in sexual health. Health equity. Advocacy efforts focus on promoting health equity by addressing the social determinants of health that contribute to disparities in sexual health outcomes. This includes advocating for equitable access to health care, comprehensive sexual education, and resources for marginalized communities. Supporting marginalized communities. Marginalized communities, including LGBTQ+ individuals, people of color, and those with low socioeconomic status, often face significant barriers to accessing sexual health services and education. Advocacy efforts work to remove these barriers and ensure that all individuals have the resources they need to maintain their sexual health. Policy and legislative advocacy. Legal protections. Advocates work to enact and enforce legal protections that uphold the sexual rights of individuals. This includes anti-discrimination laws, protections for LGBTQ+ individuals, and policies that ensure access to reproductive health services. Funding and resources. advocacy efforts also focus on securing funding and resources for sexual health programs and services. This includes lobbying for government support, grants, and partnerships with organizations that can provide financial and logistical support. Community engagement and empowerment. Grassroots movements play a crucial role in advocating for sexual rights and health. These movements often emerge from within communities and are driven by the individuals most affected by disparities and discrimination. Empowering individuals. Advocacy efforts aim to empower individuals to advocate for their own sexual health and rights. This includes providing education on their rights, training on advocacy skills, and creating platforms for their voices to be heard. International advocacy. Global efforts. Sexual health and rights advocacy extends beyond national borders. International organizations and coalitions work to promote sexual health and rights worldwide, addressing issues such as gender-based violence, reproductive rights, and LGBTQ+ rights. Cultural sensitivity. Effective international advocacy requires cultural sensitivity and an understanding of the unique challenges faced by different communities. Advocates must work in partnership with local organizations and leaders to create sustainable and culturally appropriate solutions. Integrating education and advocacy. Collaboration and partnerships. Interdisciplinary approaches. Integrating education and advocacy efforts requires collaboration across disciplines, including healthcare, education, social services, and law. Interdisciplinary approaches ensure that efforts are comprehensive and address the multifaceted nature of sexual health and rights. Partnerships with organizations. Forming partnerships with organizations that specialize in sexual health, education, and advocacy can amplify efforts and reach a broader audience. These partnerships can leverage resources, expertise, and networks to create more effective programs and campaigns. Engaging key stakeholders. Community leaders and influencers. Engaging community leaders and influencers can help promote sexual health and rights within communities. These individuals can act as advocates and role models, fostering acceptance and encouraging open discussions about sexuality. Policymakers and educators. Working with policymakers and educators is essential for creating systemic change. Advocates can influence policy decisions and curriculum development to ensure that sexual education and health services are prioritized and adequately funded. Conclusion. Education and advocacy are essential for promoting sexual health, reducing stigma, and supporting diverse sexual identities. Comprehensive sexual education and public awareness campaigns provide individuals with the knowledge and resources they need to make informed decisions and foster inclusive attitudes. Continued advocacy efforts address disparities in sexual health and rights, particularly for marginalized communities, and work to create a more equitable and inclusive society. By integrating education and advocacy, we can promote safer practices, support diverse sexual identities, and ensure that all individuals have the resources and rights they need to lead healthy and fulfilling lives. If you enjoyed this, please don't forget to like, subscribe, share, and leave a comment. Thanks for listening. Madan Mohan, Global Humanity Mission.